In this episode of the Nurse Practitioner Podcast, Sheila Melander and Kim Tharp-Barrie discuss self-care on the COVID journey. Can you both begin by discussing some of the common struggles our nurses are facing today?
Yes. So today, COVID is still with us. It continues to plague our nation. Our numbers had been higher a couple of months ago than we had ever experienced last year. We're starting to dip a little bit, but who knows what's going to happen with the flu and as winter is coming on. So that continues to be a struggle that we face, as well as we have many nursing shortages all across our country. It's very widespread. So we have multiple components that are interplaying together to even make this more of a stressful situation on our nurses and our nursing workforce. Across the country, our travel nursing numbers are higher than they have ever been before. We have large salary discrepancies, and many times we have nurses working beside each other that may have even started in a facility together, but one left a facility to work for a traveling agency and may find themselves back in the very same institution where they began. So that causes a lot of discourse between APRNs, RNs. We have it across the spectrum. We have continued stress with deadlines, continued stress with projects. Remember, many things were put on hold for a year and a half now, so that work still needs to get done. So that continues. There's conflict around time management, which persists. Our problem is keeping everyone motivated as we continue with this journey of COVID and trying to care for ourselves as we move through this. We have work-life balance issues that are not improving because we still have these multiple needs that we face in nursing. We have, in many places, lack of institutional support, in some places and in some instances, lack of personal support, and concerns actually about the future and how much longer can I continue with this? And the thing about this is before COVID even started, we had 54% of nurses in full burnout, 54%. We had 60% of nurses in full burnout mode before COVID. We had travel nurses, which was already on the increase, but now that's exploded. And 90% of college students report mental health impacts from COVID, and half of our health workers are reporting burnout amidst COVID-19, which continues to be with us. So those are common struggles that I list just right off the bat, and I would like to turn it over to Dr. Tharp-Barrie to add to these discussion points.
Yes, thank you, Dr. Melander. I would just add 2 or 3 things to that list. I think the non-traditional instruction that many parents are having to pick up at home due to the school schedule disruptions are huge for many of our parents. I think also of late, the supply chain interruptions have been horrific in the trenches. You know, early on with COVID, we dealt with the personal protection equipment, the PPE deficits, if you will. But now that, as you're well aware, if you've watched the news, you know, we have large boats and barges sitting around our ports that are full of critical supplies. Sterile water, for example, is one of those that we've had to deal with recently in our organization. So supply chain interruption is huge. The last thing that I would add to this list is just transition to practice deficits. Many of our new grads and even nurses training in that APRN arena, garnering new credentials and new experience, were not able to get the clinical exposure time that they've needed. So we're having to look at how to support them in that transition to practice experience, and it's difficult to have the resources often to apply to that need.
Can you discuss techniques that could be useful in balancing stress?
Yes, I'd love to talk about a few techniques, and one of the first ones is for us to try to just identify sources of our stress. And many people have found keeping a stress journal has been crucial in this exercise for them. And in doing that, it's helpful for us to be able to identify how we feel, both physically and emotionally, and to note how we've acted in that response. What does that cause us to do? How do we act physically? How do we act emotionally? And note in your journal what you did that made yourself feel better. What worked, what didn't work, what can we continue to learn about ourselves as we go through this. So that's one exercise that many have found continually helpful with stress. And Dr. Tharp-Barrie is going to talk about quite a few other measures in this section that I think many will find beneficial in affecting and battling stress.
Yes, thank you again, Dr. Melander. And again, as Sheila mentioned, Dr. Melander mentioned the emotional and the physical stressors and raising awareness in those categories. We tend to use a wellness wheel where we also add things like, intellectual awareness, spiritual awareness, environmental awareness, financial awareness. Many couples and many individuals have suffered gravely financially. And so this is just a really good time to do a self-awareness check around what is truly causing your stress and how can you alleviate some of those stressors. Some of the things that we found to be very helpful include a wellness toolkit. So in that toolkit, we've done a value analysis, for example, and we've asked people to truly rank their top 5 core values. And so just to give you an example, if someone asked me, Kim, what are your top 5 core values? I would say faith and family and friends and wellness, and I might say security. So we've all got those 5 core values that we hold near and dear to our heart. And when there's not convergent validity between what's important to us or what's a value to us and maybe what we're being asked to do or what's important to an institution that we're serving, we begin to crack and we become very fragile. So just having a handle on what's important to you and then making sure that you're letting someone know that you're fragile. So the first thing we try to do is raise awareness. We give people permission to be fragile. We ask them to let themselves be vulnerable. We literally say to them, it's okay not to be okay. We know that there's a direct correlation between a provider's ability to care for others if they can care for themselves. And so just, again, to raise that awareness about what matters to you, what can you control and what can't you control, what can you focus on and how can we help you around that focus, I think is very important.
Can you elaborate on some resiliency exercises or discuss ways to stay resilient in times of uncertainty and complexity?
So what I have learned in researching a lot of this is there are 6 A's that seem to be very, very helpful for many of us. So I'm going to start and just run down those real quick with you guys. So avoid is the first one. So learn to say no, as you just heard Dr. Tharp-Barrie talk about. We need to learn to know our limits and then better than that, even stick with those limits once we have identified those. We have to learn to take control of our environment also. If watching the news makes you anxious, don't watch. We need to learn to pare down our to-do list also and drop tasks that aren't necessary right now. So that's avoid. Alter is the second A. Be willing to compromise. We have to learn to create a balanced schedule. I heard this saying and I love it. We need to try to be more Teflon than Velcro. I have that kind of as a saying for myself these days. So that's alter. The third A is adapt. So try to look at the big picture. Is it really going to matter in a week, a month, 6 months? And try to learn to set reasonable standards for yourself. And then practice gratitude. So those fall under adapt. The next A is accept. And we have to try to learn to not try to control the uncontrollable. A long time ago, I learned how to do 2 circles. One's my circle of influence, and I write in that circle of influence what I have control over. And if I have issues I'm dealing with that are outside of that circle of influence, I have to figure out how to let those go because I really can't control that in my life. Under accept, we live in an imperfect world, and you and other people are going to make mistakes. We make mistakes. I make mistakes every day, multiple mistakes every day. So we just have to learn to be okay with that and with ourselves. And you heard this before from Dr. Tharp-Barrie, I believe, but time is finite. It is not limitless, and we need to make choices that fit our timelines. The next A is agility or staying agile. So we need to move away from approval seeking, move towards our values, as you heard. Become non-reactive or less reactive even. Try to dump that perfectionism, Try to default to curiosity instead. Be okay with not knowing, and trying to be okay with uncertainty will help us go a long way. Ask for help when we need it, and use your body as an early warning symptom. Early warning system. You're going to hear Dr. Tharp-Barrie talk about that again in a little bit. Awareness, what are we feeding? Are we feeding insecurities? Are we feeding things that make us stronger? And under awareness, have increased awareness and need to acknowledge your thoughts and feelings. Be aware of your interior state. We've got to acknowledge grief, and we have to learn that emotions need motion to move out. So being aware is key. There was a family physician's resiliency study, and it found 4 main aspects. So the first one was attitudes and perspectives. So valuing the provider role, maintaining interest, developing self-awareness, and accepting personal limitations is one aspect. The second one was balance and prioritization, setting limits, taking effective approaches to continuing our professional development, and honoring the self. The third aspect was practice management style, sound business management, having good staff, and using effective practice arrangements. And then 4 was supportive relationships, maintaining those and growing and developing those positive personal relationships and effective professional relationships. And then lastly, good communication. So I think all of these are very effective in helping us navigate this uncertainty and complexity time and helps build resiliency. And at this time, this is a huge area that Dr. Tharp-Barrie is really working in her institution, which is a multiple institution. It's a 5 hospital system institution. So I want her to talk a little bit about activities that they are doing around resiliency that might be able to be replicated elsewhere so that we can all learn and not have to reinvent the wheel with some of these activities.
Yes, thank you, Dr. Melander. And while this is geared primarily toward the APRN, and I'm so excited that we're talking about that critical role as we look at providership and taking care of our community. Note that in my role, we take care of 17,500 employees that serve that 5 hospital system that Dr. Melander referenced. And so interprofessional collaboration has been a really big piece of this, realizing the importance of the team plays. And so I think we can't underestimate the value that the APRN and other provider leaders can bring to the table in honoring that interprofessional collaboration piece. And then with that, I'd like to go in and discuss a few of those potential tools that are in our toolkit that, again, can be applicable to anyone and everyone that's listening to this podcast currently. And the first one is just listen to the smartest provider in the room, and that's your own body. And we all know that as providers, we're servant leaders, and we tend to take care of everyone but ourselves. And so, we know the clinical signs and symptoms of depression. We know the clinical signs and symptoms of chronic pain. We know what happens to us when we don't get enough sleep and rest. We're always coaching others instead of just listening to our body. So the first thing you have to do to raise self-awareness is be still and just listen, and then act to keep yourself whole. I think some of the other things that you can do to do that Dr. Melander alluded to earlier, she mentioned time. And as we talk about values, time today is probably one of our greatest values. If we've all recognized anything throughout this entire COVID journey, we've realized the importance of time. And so I'm really pleased to say that our organization just elected to take a time out. And while we're extremely savvy about achieving metrics and outcomes and desired results, we realize that time is the most valuable thing a man can spend. And so I'm happy to just say that the day after Thanksgiving, we've looked at our non-urgent providers and we've allowed them all to take the day off. We're literally going to shut down business across the board where we can afford to, and obviously keep our emergent care streams flowing. But we're saying to our employees, we recognize the fact that you're tired and you're overwhelmed, and we've heard you, and we're going to take that time out. I realize that not everyone has that opportunity, but what you do have an opportunity for is for voice and an opportunity to better know yourself and to work within your capacity and your boundaries. So that's another important part of this toolkit, is to do those daily self-assessments. Again, Dr. Melander referenced that journal. how are you feeling today? Just start out with, how do I feel today? And then realize what your capacity and boundaries look like for that day. Take it one day at a time. And doing so, we also have to look at time management and prioritization. What's urgent? What's important? What do I need to do first? What do I need to schedule because it's less urgent? What can I delegate? And what can I ignore for now? So it might sound super simplistic, but and this is a Kim Tharp-Barrie-ism, if you will. There have been times when I've been extremely tired and overwhelmed throughout this whole COVID journey. And maybe an employee comes to my office and I've had a long 10 or 12-hour day, and they just say, I need 2 minutes of your time. And before I know it, I've given them 20. There have been days when I've said, okay, look, is anybody bleeding out? Do I need to call a code? Is there a major infraction that's occurring? Is something going to end up on the front page of the newspaper? If the answer is no to all those things, I tuck it away and I tell them to come back tomorrow, because I, too, as a leader, have to know my capacity and my boundaries, and we all need to be comfortable with letting ourselves be vulnerable. I think the other thing that I'd like to discuss is all the tools that are out there to help you with that self-awareness and self-assessment piece. So one of those is strength finders. Learn to play to your strengths during a critical time like this. And you can go out and Google strength finders. It's a Gallup tool. I think another great tool is the Kilmann Toolkit. It measures and allows us to look at how do we manage conflict? What's our go-to mode? And essentially, you can answer 30 questions, and you'll know that during times of conflict, do you tend to be competing or collaborating or compromising or avoiding or accommodating? And it's very important that you get a handle on that, because if you avoid too much, then you can become overwhelmed very quickly. If you compete too much and try to fix everything, you can become overwhelmed too quickly. So that whole self-awareness piece can be enhanced with some very inexpensive tools, self-help tools that are available to everyone. And then I have two other things I'd like to mention that we coach all of our team on, and that is how to prevent bullying, because WICs are short right now. And we all know that some people become more assertive and sometimes even aggressive during times of crisis and conflict. And so we use this one little tagline that I'm pleased to say I adopted from an Oprah Winfrey show when she was interviewing the judge, believe it or not. And they talked about how to really provoke inner peace among their family during times of conflict. And it's a one-liner that simply goes like this: thanks, but that's not working for me. Or thanks, but this doesn't work for me. And so we've empowered our new grads, for example, or a new APRN that's transitioning into a new role perhaps, to just say to a nurse, for example, Sally, I know you're a great nurse, and I know I can learn a lot from you, but when you talk to me that way in front of the provider team, you take away my sense of being, or you take me out of my game. And so just by saying thanks, but this isn't working for me, I'm not saying that anything's wrong with you. I'm saying I'm not going to take this anymore. I'm setting boundaries. So that's a really good thing to remember, is just this isn't working for me. And it works at home. It works with spouses, with significant others, with grandbabies, with your children, right? So think about that. Just saying to someone, I'm taking control of the situation. Your behavior is not acceptable and it's not working for me. The second thing that we do along that same line with setting boundaries is to teach people how to say no with a yes. So many times what we hear from APRNs in the trenches that are being asked to pull off of their daily schedules and assist in a clinic situation, perhaps it's giving vaccinations, perhaps it's working through vaccination declinations that have been very cumbersome for all of us. We've taught them to say, you know what, I'm happy to do that, but I just said yes, to Dr. Smith. And could you possibly look at me maybe helping you next Thursday and Friday? Today's not working for me. Or, we've even taught our PCAs and others in an interprofessional team that may not feel as empowered to say, I'd love to help you with Mr. Jones, transition to radiology, or with Sally Smith's bath. But I just said yes to, getting the warming blankets ready for anesthesia in the post-surgical room. And so we're teaching them, again, not to say no, but to just be empowered enough to say what they are doing so that someone looks elsewhere for help, because we're all overwhelmed right now in the trenches. So those are just a few of the things that we have in our toolbox. Some of the more blatant things, I think, is not being afraid to look toward, your employee assistance program if you have one, not being afraid to go to your direct report, the people that that direct report to you or the person to whom you direct report, and just asking for some help or for a timeout. And then also where you have clergymen on call. We're a faith-based organization at Norton Healthcare, so we have 24/7 clergy on call to help all of our providers when they have issues or in distress.
What other measures would you like to stress that can be helpful in these times of extreme stress and fatigue?
At this time, I think we just need to help each other to keep showing up every day as we keep being assaulted, bombarded, we're exhausted, there's new crises every day. So I want to talk about the importance of social support. There are multiple studies out that show strong support from a mentor is the key piece that keeps people motivated and moving through a crisis. Harvard had a study of 1,648 people that showed social support was the greatest factor for contentment and most important for helping people maintain during periods of high stress. So you cannot be isolated. Sometimes when people feel very stressed and they're at their wits' end, they kind of move away from their peers, from their family, and they kind of isolate themselves. That's the worst thing we can do, and we need to watch each other and help each other, and when that's happening, pull in instead of pulling away. And to just help understand the importance of communication also. I have a really good colleague that always talked about this is a marathon, this is not a sprint. So you have to kind of set your intentions every day as you get up, that these are going to be things I'm going to focus on, and I'm going to be present with peers, families, friends, my work family, and be there for them. For some, it's your church group, it's your friend group, wherever you get fed, wherever you get the most encouragement and support, that's what you have to reach out to. And that's the most difficult thing to do sometimes in very, very high times of stress. Another thing that we wanted to mention real quick, for the first time in the Future of Nursing 2020 to 2030, they have a chapter dedicated on supporting nursing, and they talk about eliminating structural stressors. And we can't ignore this time that due to the amount of stress, our nursing suicides are higher than they've ever been in our past. So the American Nurses Association has highlighted this last month, actually, the month of September. This was highlighted in order to call this out to the nation, actually. So we want everyone who's listening to this to know that when you're in crisis, you're not alone, that we all go through periods of depression and that it's treatable, and that we're not immune to the effects of depression, and we need to ask for help at certain times. So we just wanted to make sure everyone was aware of the hotlines and that this is a topic for ANA. And there's many, many hotlines. There's a crisis hotline, which is a 24/7, and that actually is, you can text home to 741-741. There's disaster distress hotlines. There is a Safe Call Now hotline. So we can actually hopefully make these numbers available to you. The National Suicide Prevention Hotline is 1-800-273-TALK. So we're only bringing this up because we're going into year 2 now of this continued bombardment that's not going away, and due to all the workforce issues, we just had a national study with some data that came out, and locally in Kentucky, we've got 1 in 3 nurses that are planning on leaving the workforce in the next 1 to 3 months. By 2030, half of our workforce is planning on retiring. And it's not just our workforce. In our universities and colleges, our faculty vacancies are at a 3-fold low over the past 10 years. So we are running on fumes. So this is not going to turn around quick. So Dr. Tharp-Barrie and I know this is not a one-shot stop, that we all are going to need continued support and help getting through this. So at this time, Dr. Tharp-Barrie, I know that you address this concern daily. So what else would you like to share to our listeners?
Yes, thank you. Just a few more details maybe to support what Dr. Melander has just mentioned. And the first thing I want to do is thank Dr. Melander and her colleagues at the University of Kentucky because I think that, we have to partner. So as a leader, as an operations leader for a large company in Kentucky that serves 56 to 57% of Kentuckiana, I think we have to begin to partner with academicians and look at the fact that we're in this together. Those of us that are producing providers and then those of us that are hiring those providers have to come together to be a part of the solution. So I'm just so grateful to have this opportunity today. And now I do want to touch on a few things that Dr. Melander mentioned. She mentioned daily intentions. And one of the things that we've really tried to do is touch points. And touch points look very different today with our employees than they did in the past, right? I mean, we have numbers of people that are working from home 100% of the time. We have folks that are working a couple of days a week from home. But we still have to find a way to be very deliberate and intentional about keeping those folks engaged. Engagement is really important. And as we're engaging our employees, we have to keep in mind that a lot of our patient population has disengaged as well. Many of them are afraid to come to the ER now, or to even go to the clinic, or to go be with other people anywhere, if you will. So not only do we have to worry about our providers being isolated, but we have to realize that we have to work a little bit harder to serve our patient population throughout this journey, which is also exhausting because many of them have been isolated. So touch points are really critical, whether you're texting or you're making a phone call, or whether you're doing a 15-5 rule, as we like to call it, in the hallway. Where at Norton we tend to say, at 15 feet we're nodding or we're smiling, and at 5 feet we're asking someone how they are. What we found out is that it's not enough to just say, hey, how are you? We have to really mean, hey, how are you doing? Do you need anything from me? What's your day look like? What's your resources look like? Or even better, to do that mini assessment and say, wow, you don't look so well today. Are you okay? I recently told an employee before coming together to do this with Dr. Melander today, I think you need to go home. And she broke down in tears and said, thank you, I do need to go home. So we have to be more aware of the fragility, and we have to give people, again, that permission, and we have to be even more intentional and deliberate than ever before. I think also Dr. Melander mentioned, looking at where you're being fed, what feeds you, what keeps you whole, what gives you your energy. And so, for me, it's the barn, right? So maybe in the past it was going to church, but a lot of our larger churches, shut down through COVID, and we had to find other ways to garner that moment to be introspective or to feed our spirituality. And so if you know what feeds you, be deliberate about making that time to be effectively fed. Another thing is connect to thrive. And again, Dr. Melander talked about that social connectivity, and she talked about the news, for example. We also know that Facebook and Instagram can be a beautiful thing, or it can be a horrific thing. And we've seen both ends of that continuum play out throughout this journey. So be aware when it's time to just unplug. Just simply unplug and, be introspective and take that time to heal and truly look at where you're connecting and what you're connecting to. And then finally, I would just say, don't settle. So as we age, especially as providers, and our days get longer and we're more stressed, you can many times get the answers that you need from your primary care physician. But if you're not getting what you need, then as providers, we need to dig down deep and look at what do we need at the time? Do we need more sleep? Do we need a different diet? Do we need to hydrate more? Do we need a different work schedule? And don't be afraid to make those asks. It's a very important time right now for APRNs and for nursing and for all providers to, again, not be afraid to have voice to make sure that they're securing self-care options for themselves.
Thank you for listening, and we'll see you next time. This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer.